Ladies and gentlemen, thank you for standing by and welcome to COVID-19 media briefing. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone keypad. If you require any further assistance, please press star 0. I would now like to hand the conference over to your first speaker today, Mr. Mike Schomer. Thank you. Sir, the floor is yours.
Thank you for joining us for the COVID-19 media call for September 9th. We'll start today's call with a situation report from MDH Infectious Disease Director Kris Ehresmann. Following Kris, we will hear from a series of guest speakers on the line today, including MDH Assistant Commissioner Dan Huff, Department of Public Safety Assistant Commissioner Booker Hodges, Department of Labor and Industry Assistant Commissioner Nicole Blissenbach, Department of Agriculture, Food and Feed Safety Director Katherine and Brent Frederick, owner of Jester Concepts, which includes the restaurants Burrow, Parlor, PS Steak, and more in the Twin Cities area. After that, we will open it up for questions from reporters on the line. With that, I'll now turn it over to Kris.
Thank you, Mike. Globally, this morning we were seeing 27.6 million cases of COVID-19 and 898,000 deaths. In the United States, we were at 6.3 million cases and 189,000 deaths. In Minnesota, we added 282 cases yesterday for a new total of 81,868 cases. The median age of our cases is 35 years old. The new total of deaths in Minnesota is 1,869, up from 7 yesterday. 4 of these deaths occurred in residents of long-term care facilities, 3 in Hennepin County, 2 in Dakota County, and 1 each in LeSueur and Stearns counties. The total includes 4 individuals in their 80s, 1 in their 70s, and 2 in their 60s. We currently have 263 patients hospitalized and 137 in intensive care. Just to give you an update on testing, we were at 5,373 total lab tests, which was a decrease from yesterday's 7,357. The 7-day average testing positivity rate is 5.5%, higher than the week before, which was 5.3%. The 7-day weekly average growth rate for testing is 6.4%, down from 8% the day prior and 8.1% the week prior. And testing increased by 6.4% compared to cases, the number of new cases, which increased by 6.2%. And before I turn it over to our guests on today's call, I just wanted to mention briefly that the indoor masking requirement applies to even smaller workplaces. We've heard from staff that they've run into situations where small workplaces may not have realized this requirement. But to clarify, the indoor masking requirement applies whether you employ 3 people or 3,000 people. And with that, I'd like to turn it over to Assistant Commissioner Dan Huff.
Thank you, Kris. And good afternoon, everyone. As Kris said, my name is Dan Huff. I'm an Assistant Commissioner with the Minnesota Department of Health. I wanted to provide an update today about the state's efforts around compliance checks with bars and restaurants. Bars and restaurants represent an important part of our local economy. And like all of us, owners and managers are learning to adapt to life during the COVID pandemic. Keeping bars and restaurants open is important to our economy. But to do that, we need to know that they are safe for customers and for employees. We know that most establishments are taking these safety precautions seriously. And we applaud those many bars and restaurants for their efforts to protect workers and the public. We also know that a handful of bad actors can create a ripple effect and impact the entire industry. That's why over the past 2 weekends, MDH has partnered with the Departments of Public Safety, Labor and Industry, and Agriculture to perform compliance checks on more than 150 bars and restaurants in several communities. During those visits, compliance teams observed that the majority of bars and restaurants are working to comply with COVID-19 executive orders and required guidance. For those that weren't, compliance teams have focused on helping bringing those establishments into compliance. During the weekend of August 28 to 29, compliance teams were in Mankato, St. Peter, Waseca, Faribault, and New Ulm. The following weekend, September 4th and 5th, these teams were in Carver and Scott counties. Of the 167 establishments visited, teams observed 88 businesses were following safety and health requirements. 79 bars and restaurants were not in compliance, having one or more violations. Now, of those not in compliance, 31 were referred for follow-up inspections by Departments of Health and Labor and Industry. Those issues ranged from customers and workers not wearing masks when required, failure to maintain social distancing, or a lack of COVID-19 preparedness plans and worker training. These compliance checks are not about punitive actions. Rather, this is about responding to concerns from the public and the industry and the desire for additional education. Since July 13, when the mask mandate went into effect, MDH has received and followed up on over 800 complaints of executive order violations at restaurants and bars regulated by MDH, and has referred over 400 additional complaints to our delegated agencies. MDH has investigated 68 case clusters of patrons visiting 66 different bars and restaurants. 38 of these met the definition of an outbreak, with 1,210 people infected with COVID. MDH has identified another 58 suspected outbreaks involving employees at bars and restaurants. Now, these numbers represent a fraction of the thousands of bars and restaurants in the state. But we all have to do our part, and so we appreciate the continued cooperation from everyone. I'd like to now turn it over to my colleague from the Department of Public Safety, Booker Hodges.
Thanks, Dan. This is Booker Hodges, Assistant Commissioner for the Minnesota Department of Public Safety, overseeing alcohol and gambling enforcement, the Minnesota State Patrol, and the BCA. First, I just want to thank all the bars and restaurants that have adhered to the executive order and done their best to keep people safe. Our initial strategy from DPS was focused on education, but after 3 months of education and published enforcement efforts, our strategy has shifted more towards enforcement, unfortunately. Some of our neighboring states have had more restrictions placed on bars and restaurants. Those include closures in certain areas, ban on indoor seating, or restrictions on alcohol sales after a certain hour. In Minnesota, we want to avoid such restrictions, and as Assistant Commissioner Huff had just stated, MDH has investigated 68 case clusters of patrons visiting 66 different bars. This has resulted in over 1,200 cases of COVID. We want to keep people safe. At the same time, we want to keep our businesses open. So for us, instead of penalizing the entire industry for the actions of those who are not following the rules, we are taking a more targeted enforcement approach by addressing those who need addressing. We want to go out to bars and restaurants to observe. When we go out to bars and restaurants to observe, Our goal isn't to hammer people. It's to go out and educate businesses, workers, and customers. And if they need help, we're here to provide them with help. Enforcement is not used to enforcement is not used to punish businesses, but rather ensure that a level playing field exists where all businesses can succeed and keep people safe. So with that, I will turn it over to Assistant Commissioner Blissenbach from the Department of Labor and Industry.
Thank you, and good afternoon. I am Nicole Blissenbach, Assistant Commissioner at the Minnesota Department of Labor and Industry. Just have a few things to add to the comments from Assistant Commissioner Huff and Assistant Commissioner Hodges. I want to start by emphasizing that compliance checks and this increased enforcement effort aren't just about keeping customers safe. They're about keeping workers safe. Our OSHA compliance division here at Labor and Industry is receiving numerous calls every day from workers concerned about their safety at work. While OSHA continues to follow up on those complaints we receive, this enforcement effort allows us to be proactive and strategic in our efforts. Specific to our increased enforcement efforts, one thing to note is that our inspectors have observed that in some situations, while businesses are making efforts to follow the guidance requirements and the requirements in the executive orders, customers are not always doing their part. Some customers are refusing to wear masks. Others ignore social distancing guidelines by moving tables and chairs to accommodate larger groups. These customers are not only putting the health and safety of others at risk, they jeopardize the operations of these businesses, as Assistant Commissioner Hodges just laid out. We know that COVID-19 can spread easily in bars and restaurants if proper precautions are not followed. People tend to be in close proximity to one another in bars and restaurants. They're talking, sometimes loudly, and of course, eating and drinking doesn't allow for mask wearing. Patrons can be in these establishments for long durations of time and have many high-touch areas. A single employee is likely to interact with dozens of different customers over the course of a shift. And as mentioned earlier, again, by Assistant Commissioner Hodges, an outbreak of COVID in one bar can lead to an entire community outbreak through the spread from patrons to their household members, coworkers, and other members of the community. We know that a high percentage of bar and restaurant employees are people of color, adding to the inequitable impact of this virus that we are seeing in the state. While we understand that customers can sometimes create challenges to following the safety requirements, it's ultimately the responsibility of a business to provide its workers with a safe and healthy workplace. And that is the primary focus of Minnesota OSHA and the Department of Labor and Industry. So with that, I will conclude my comments and pass it on to the next speaker, Katherine Simon from the Minnesota Department of Agriculture. Thanks.
Thank you. This is Katherine Simon with the Food and Feed Safety Division of the Minnesota Department of Agriculture. As was already shared from the previous speakers, slowing the spread of COVID-19, it's not an easy task. In order to do so, we do need everyone to feel knowledgeable about the best practices and to follow the requirements and the guidelines. This is what's going to help keep workplaces safe and healthy in order to keep those businesses open. This is going to include wearing face coverings, making reservations to include following the on-site reservation systems, practicing social distancing, and keeping the capacity to 50% or no more than 250 people in any establishment. Businesses should have a COVID preparedness plan, but more importantly, they need to make sure they understand their plan so that they can successfully maintain it. We would encourage businesses to work collaboratively with their regulators so that they can find ways that they can be successful with implementing the guidelines in their facilities. This will help with making sure that additional restrictions aren't going to be needed. That concludes my comments, and I will pass it on to Brent Frederick of Jester Concepts.
Thank you, Katherine. As she said, my name is Brent Frederick. I'm the owner and operator of Jester Concepts, a local ownership and restaurant management company here in the cities. We have 3 locations in Minneapolis and 1 in St. Paul, including Borough and Parlor North Loop, the Hotel Ivy locations, Manello and Constantine, TS Steak in Minneapolis, and then a parlor in St. Paul, as well as a food truck. We also manage and operate a food stand in the Target Center under the Parlor brand as well. Just a quick kind of state of the union for us as far as COVID goes. Our sales volume is 40% of where we were pre-COVID. That's not all stores. Some are at 70%, but others are at 30% and in some cases 20%. So they kind of range across the board as far as where our sales volume is at. We were able to retain about 95% of our management, and we have about 75% of our hourly employees employed compared to pre-COVID. We have been forced to cut hours on the night side. We've cut lunch at 2 of our locations, looking at possibly cutting lunch on a third. We've had to get very creative in offering third-party delivery companies where we were not familiar beforehand. So that's a little quick snippet of where our company, maybe not a complete kind of analyzation of the industry as a whole, but I guess it's fairly close. We're gladly embracing all the state mask requirements and especially the enforcement. When Minneapolis was the first city to come down with the mask requirement, it was somewhat tough to enforce. And when the state came down with the statewide one, it was a sigh of relief. We had a lot more people taking it seriously, and we didn't have as many problems after the state mandate. So we are warmly embracing those requirements. We are complying with it, and as far as enforcement goes, we love the accountability. If we're not adhering to the practices, then we're expecting to be held accountable. And I think every restaurant and bar in the state of Minnesota should be on the same page with that. So we warmly embrace that. I think the key part of this is consumer confidence. We need to grow that as an industry, as a state, make people feel more comfortable coming out. As a company, we're investing in technology in our HVAC units to try and provide clean air and purification of the air that does not contain COVID or even flu-like viruses. So that is one way, along with all the safety measures and the cleanliness practices, that we are helping to keep our guests and our employees safe. And with that, I'll give that back to Mike. Thank you.
Thank you, Brent. Operator, we're ready to take questions.
As a reminder, to ask a question, just press *1 on your telephone keypad. If you would like to withdraw your question, just press the # key. Your first question comes from the line of Jeremy Olson from Star Tribune.
Hi, my first question, I guess, would probably be to Kris. The number of cases identified with these clusters compared to total cases in the state, that's less than 2% related to these bar and restaurant clusters. Do you have any information on secondary cases that sprung out about this? I guess I'm just wondering if we're looking at the right target in bars and restaurants when that's such a small share of the total pie.
Thanks, Jeremy. Well, a couple of things. I think as Assistant Commissioner Huff mentioned, we recognize that the establishments where we're seeing the transmission represent a small proportion of total establishments, and that's why the goal has been to work with situations where we're not seeing compliance with guidance in hopes of bringing people in rather than, having to take further action. When we look at the 66 establishments that have been investigated, we're at 1,592 unique cases. And so, although you recognize that represents a small portion of our total cases, those cases have seeded a number of additional situations. So as we mentioned, some of these individuals, are working in child care, in long-term care, and health care. So that makes a difference as well. And then the other thing just to mention is these are the only situations that we've been able to document. That doesn't mean that there isn't activity, that is occurring. And so, yeah, we recognize that this is an area where we have concern about transmission. We recognize that transmission is not occurring everywhere, and that the vast majority of establishments are operating, like we heard from Brent about how his establishments are working. But we do recognize that this is a concerning area that has contributed to transmission, and so that's why we're working on how we can best work with establishments so that they can be successful and so that we can be successful in controlling COVID.
I have a follow-up question. Brent had mentioned HVAC and, reducing spread through the air system. We don't know a lot about, or do we? Do we know a lot about the aerosolized spread of COVID and this virus yet? And do we have enough information where we can tell restaurants how to protect themselves through improvements to their airflow?
We recognize that, close, crowded situations will contribute more to the transmission of COVID. And so that's partly why being outdoors makes a difference because of the better airflow. So situations in which airflow is improved are going to help. In terms of being able to, eliminate the virus, I don't have enough information to be able to comment on that, but I do know that better airflow makes a difference in terms of reducing the likelihood of transmission.
Thank you.
Your next question comes from the line of Matt Sepik from Minnesota Public Radio.
Hi there, Kris. I am wondering about campuses, as I'm sure you are, and how colleges are enforcing quarantines. And I'm also wanted to ask if you're concerned about students leaving campus for home and bringing COVID with them, given what we've seen on campuses all over the country.
Thanks, Mark. Yes, the great questions. That is a conversation that we've had and that I think many states have had, is that as you look at transmission of COVID within a college or university population, obviously as you're seeing increasing transmission, a natural response might be to say, oh, so much disease, we've got to shut this down and send people home. But the concern, rightfully so, is that by doing that, do you perhaps reduce transmission in that environment, but then disperse it to other locations? And so that's a consideration that we have been looking at, and that's partly why some colleges are looking at a kind of a mini shelter in place to say, you know what, we've got activity here. We want, rather than closing our campus and sending people home, we want to kind of shut down the activity on our campus to both limit transmission within our students, staff, as well as limit the potential for transmission to other communities. And so, yes, we're working with our colleges and universities to look at that as a viable option and a way to help address the transmission that we're seeing in those locations.
And I had a follow-up too, Kris, regarding that wedding in southwestern Minnesota that you had spoken about last week. Are there any more cases associated with it? Are you continuing to track it? Any fatalities or hospitalizations associated with that one event?
Yes, we are continuing to track cases associated with that wedding. I will double check to get the most recent numbers. The last that I had heard was as of Friday, we were at 58 cases associated with that one event, but I will double check that and get you a more updated number. Thank you.
Okay, thank you.
Your next question comes from the line of David Orick of Pioneer Quest.
Yes, hi. Thank you. Did you guys select these 167 establishments based on complaints? Because earlier, I think it was Assistant Commissioner Huff said a handful of bad actors. But out of the ones that you guys checked, it's 47% non-compliance. That's not a vast majority of compliance, and that's not a handful of bad actors, but the way I would describe it. Were these all suspected to be out of compliance or something?
This is Dan Huff. I can help address that. So we have two different processes. We have complaints. Complaints come into each of our departments, and then we all follow up on those, investigate and verify the complaint, and then take whatever action is needed. For these sweeps, we are choosing a geographic area, and we're taking a number of factors into account. We're looking at how many businesses we have in the area. We first look at case counts and where do we have concerns around disease spread. Are there other factors that are changing? For example, colleges or universities coming back in session. Do we have other issues, or do we have a concentration of complaints? We then pull all the licensed businesses for that area, and we select about 100 from that list to do our sweep in that particular targeted area. Now, so this is a separate process from our complaint base. When we say the few bad apples, we have, as you noted, about, was it 47%? I'll trust your math on that. That have one or more violations. Please know that many of those have one minor violation. There's that smaller subset that we did follow up on. So those are ones that we deemed this needs additional inspection. And that number was 31. So a much smaller number. Of those, we are issuing very few actual enforcement actions. Because what we find is most people, when we are able to meet with them and educate and explain the rules, come into compliance. When we talk about a few bad actors, that's what is resulting in these large outbreaks. So we have over 1,200 people in known outbreaks, over 1,500 people with some of these other suspected clusters. That's actually a lot of people. When you think that, Minnesota in March, we had one case at the beginning of this outbreak, and now we're at over 80,000 because the cases spread. So what we want to do is to look at everyone that we can to make sure that we're all following the rules. And for those that are where the rules are completely breaking down, those are where we see the greatest risk for these type of outbreaks. Thank you.
Thanks. Quick follow-up. You said of the 31 where you, for follow-up action, which is 18.5%, only some of those required actual enforcement. Could you explain a little bit more? Did you actually write any citations, or what are you talking about there?
Sure. Well, so first I'll add that our investigations are not complete, so we don't have information to release. But I'll describe our process. We come back and we do an inspection. Many of those, any violations that we find can be corrected then or through orders with the owner. It is only specific violations or upon a reinspection that we might need to move to enforcement action. So I can't give you the exact percentage right now because many of these cases are still under investigation, but that gives you an idea of how our process works.
Okay, thanks.
Next question comes from the line of Greta Cowell from Minpost.
Hi there. I was just taking a look at the dial-back dashboard, and it looks like, if I'm relaying this correctly, 3 out of 5 of the metrics were above the level of concern. I'm wondering if there's a specific level at which things would get dialed back if all of them were above the level that was desirable or below in the case of testing. Sort of whether that dashboard has teeth or if it's just something that we're looking at.
Well, this is Kris, and then I'll see if Assistant Commissioner Huff would like to comment too. We do provide, information to the governor's office on actually a daily basis about what we are seeing related to COVID transmission, and certainly the dial back measures are helpful because they're consistent and repeated over time. And so we do provide that information to the governor's office, but there are multiple factors that are weighed in addition to public health factors as we're providing that information. And certainly 3 out of 5 above the level of concern is not good, and partly why we've been talking to the public about the importance of following the guidance, social distancing, masking. So yes, we are constantly providing that information, and I'll see if Assistant Commissioner Huff wants to comment additionally on that.
Yeah, thanks, Kris. No, I think you said it well. This is, we have to look at managing this pandemic through many lenses. For example, we know there are restaurants such as our owner on the line today that are doing a great job. They operate safely. They can operate safely during this pandemic. So to say that if we hit a particular threshold in our dial back, that all of a sudden we would shut down a particular industry, I think does not get to the nuance that we have really begun to learn about the virus. And so that's one of the reasons that we're doing, say, this enforcement approach. As opposed to a broad dial back, we're using a scaffold. We're looking at where are the actual issues as opposed to painting an entire industry or an entire sector with a large mitigation measure turn of the dial. So the dial backs, these measures that are on our website, we watch those daily, as Kris said, but we use multiple lenses in how to determine what do we do with that information, how do we interpret those data, and how do we use those data to best inform what's best for Minnesotans. And one of the things that we know, the best dial back we can do or dial anywhere is that everyone's using their mask and everyone is social distancing. That's what it's going to take for us to make sure that we can really keep a lid on that virus spread. Thank you.
And before we go to the next question, I just wanted to follow up for Mark Stepek. You had asked about the wedding in southwestern Minnesota. We are just finishing up looking at the data, but we will be close to 70 cases associated with that wedding as we look at things today. So we definitely have seen a significant amount of transmission associated with that single event. Thank you.
I don't know if my line is still open, but does that is that just cases directly tied to the wedding, or does that include secondary infection?
That is cases that are directly tied to the wedding. We generally don't or aren't able to continue to do the level of detailed follow-up that would link secondary transmission to a particular event, so those are directly associated.
Thank you.
Next question comes from the line of Katherine from Minnesota Public Radio.
Hi. I was hoping you could say a little bit more about something you mentioned yesterday about cases at Concordia and Minnesota State Moorhead, I believe you said. I guess I'm just trying to get a sense of what the tipping point is there. They haven't gone on quarantine yet, but can you tell us how you're advising those colleges, what you're telling them to do at this point? and whether there's any update in the case count.
I don't have an update in case counts for Concordia and Moorhead. I can tell you that Winona is at 236 cases as of today. And in terms of, what we're advising, our team works with these institutions. We definitely, are talking to them about, what kinds of actions they should take, if they should be limiting activities, all of those kinds of things. And certainly, that the action that Winona State took was a very strong action, and will hopefully have an impact on the spread within the facility, not the facility, within the campus. But we're working with each institution to look at where are the cases occurring, how are we seeing the transmission occur, and what guidance would be the best for that particular institution given their population and things like that.
And just to follow up, is this at all complicated by the fact that you've got two schools that sort of straddle two different states? Has that been an issue in contact tracing? Has it been an issue in testing, or just kind of coordinating a plan? Especially students, live off campus. Maybe, I don't know. I'm just thinking it could present an issue.
Yep. No. It's actually a good question, and in fact, it can be a challenge with lots of border communities, but in particular, in the Fargo-Moorhead area, the three colleges have multiple connections, which is an excellent thing for education and allows students to, go between institutions for classes. It makes it a little bit more challenging from an outbreak response perspective because of that. So yes, certainly being on the border, having students that may live in one state but take classes in another does make things complicated. But I will say that our local public health agencies in Moorhead and Clay County have really strong relationships with Cass County, the Fargo side, and so they obviously work together on multiple issues, and so, they're used to this, but you're absolutely right. That cross-border issues add to the challenges of responding to this. Not only are we dealing with a younger population who may not want to be providing us with complete information, but then, as you said, we've got two different states, and we've got three different academic institutions. So it makes for an exciting opportunity for response.
Got it. Thank you.
Operator, we have time for one more question.
Okay, your next question comes from Sloan Martin of WCCO Radio.
Hi, I think this question could be for Kris. We had just seen news today in Los Angeles County that health officials there are ending trick-or-treating, haunted houses, and Halloween parades, and I'm wondering, it may seem straightforward about what those risks are when it comes to Halloween and the spread of coronavirus. If you could describe that, and also if there are any discussions about what could happen even on a state level, or that kind of guidance and advisory as towns and counties start to think about what those Halloween celebrations could be looking like this early.
Well, thank you for that question. And my first reaction when you asked was, do you know how when people comment that the Christmas decorations may be up too early or the Halloween candy is being sold in July, that they sort of feel like the issues are being pushed? I think that's certainly a really valid issue and something that we should be looking at, as we move into late October. I think at this point it would be premature for us to make any sort of decisions simply because we will have 6 or 7 more weeks of disease transmission to monitor, and that will inform us if things are getting better, if they're getting worse. So I do think that it's a completely valid tradition that we have, and I think it's one that we are going to need to evaluate in light of COVID. But I'll claim that I don't put my holiday decorations up until after Thanksgiving, and I'll say that we will have guidance related to Halloween a little bit closer to the date.
I'm with you there. Thank you.
All right, that is all the time we have for the call today. I want to thank our guests who've been on the call. If reporters have any follow-up questions after the call, please feel free to reach out to the MDH Communications Office this afternoon. Have a good day, and we will be back with you again tomorrow.
Ladies and gentlemen, that concludes today's conference call. Thank you everyone for participation. You may now disconnect. Connect. 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 Connect.